that was sort of following on from some of the changes I've made in the breast cancer service in Greater Manchester, and also leading systemic therapies for the last 9 years in Greater Manchester, that there are better ways for looking after patients. And going back to when I started in 2001, there's very little trial activity in the Christie. I mean, it's renowned now for being a trial centre, but what was going on when I started there was very low level. It was sort of lab-based research of particular interest for my predecessor. He wasn't doing national trials or international trials to any large scale. So I took the approach that, we should be offering a trial for every patient in every setting, and engaging with all the drug companies, because they have most of the new treatments that are going to come through to change outcomes, survival, etc. And formulating the service around that so that, we had the right team in place to talk to patients properly. So back in the day, I put it, when a new patient would come, they'd have an hour with the consultant or registrar. They'd have up to an hour if they wanted with a breast care nurse and with a research nurse. So it was all a package so that they weren't, just bombarded in 5 minutes and told, do you want to go in this trial? It's about explaining things properly. And that's the sort of setup that you need to really look after patients properly. And I'm very proud that actually I set up a secondary breast cancer service in the early 2000s, and still, at the end in 2020, most places in the UK don't have a secondary breast cancer service. And a key part of that was sort of bringing in, making the nurses in that service dedicated secondary breast cancer nurses rather than surgically orientated breast cancer nurses. So they're experts in supportive care and have a good understanding of systemic therapies and the side effects. Also brought a specialist in supportive care, palliative care, end-of-life care. That was a key part as well. And building a system where you talk to patients properly about actually going on to another line of chemotherapy when 2 have failed is not likely to be helpful for you. But you do need that support package around the patient to be able to offer them something different. And that's where clinical trials come in. So my experience is sort of, and the reason I developed that was a lot of my training was actually from coming out of the hematological oncology background. I spent 5 years on the leukemia unit working in the Christie, so it's quite ironic that I ended up in there as a patient. So, but my experiences there were not what I would have liked them to be, so that I wasn't really looked after as a person, and I was very much treated like a commodity, and very much felt, that I was just there to had things done to me and treated in sort of surgical fashion, as though I wasn't involved in the care. And then the opposite happened sometimes. So some of the doctors who knew I was a consultant there would ask me, what do I want done to me? And I said, well, actually treat me according to your protocol. You should have a protocol to manage this situation, and you shouldn't be asking me whether I think it's the right thing to do, because I'm the patient now, I'm not the doctor. So I found that an interesting conundrum. And I suppose going forwards, my desire is still to get trials out to patients, because it is challenging to do all that travelling when you're suffering from the burden of treatment. So I was travelling, for 30 odd miles from the Pennines in West Yorkshire, which is where we live, and it was the middle of the hardest winter we've ever had on history. Well, I wasn't travelling, my wife was travelling most of the time. So there was my daughter and the dogs, and it's how did they, going backwards and forwards. And the times when I was out of hospital, it was difficult. And then I'd have to travel into the hospital to get, access to treatment sometimes, even, simple things that could probably have been done remotely if we had a proper connected system, which is really what we need to get back to, is a proper NHS where people work together across the system rather than each individual trust trying to say they can do everything, because we know that's not feasible in this day and age.